I am Claudio Cerchione. I work in Istituto Romagnolo per lo studio e la cura dei tumori di inamatori, located in Meldola, northern part of Italy. ASH 2024 was an amazing conference. We have seen many novelties, and I think that research in hematology is reaching outstanding results. But particularly, I think that the revolution in multiple myeloma is going to continue. And we have seen several outstanding novelties in different settings. Particularly, I will start from early stages. Smoldering myeloma, we have seen in high-risk smoldering myeloma several novelties, several new results, starting from Aquila study, in which daratumumab has overcome the observation, the watch and wait strategy, and I think that monoclonal antibodies anti-CD38 will be the next future of early stages myeloma. Also waiting for the results of monoclonal antibodies based treatments such as ITACA, isatuximab, lenalidomide, dexamethasone, that I'm sure that will be game changer even if we don't have interim result. Also carfilzomib with lenalidomide, dexamethasone has shown superiority versus Lendex in high-risk smoldering, and also we have seen the first data with the cilta-cel in early-stage myeloma. So I think that we should be ambitious, particularly with patients that have not developed the symptomatic disease, and I think that MRD negativity should be the real endpoint in these patients. However, what is today, I think, a certainty is that we have to treat these patients. The high risk should be absolutely treated because they have too high rate to develop a symptomatic myeloma. Going in frontline myeloma, I think that the most important novelty is the study GMMG HD7 that has shown isatuximab addition to bortezomib, lenalidomide, dexamethasone is a BRD, and also in this case I think MRD negativity is going to become in transplant eligible patient the real endpoint, which correlates to the best long-term outcomes. The therapy has shown incredible results in terms of overall response rate, MRD status, but also in terms of tolerability. I think that is going to be one of the potential next future standard of care, also according to the combination of VISA plus lenalidomide in the maintenance randomized with the lenalidomide. In relapsed refractory setting, we are going to see many new results, incredible updates with belantamab DREAM7. Belantamab, bortezomib, dexamethasone has shown the first data in terms of overall survival, and I think that in early relapse, particularly in the one that have been treated in frontline with anti-CD38, belantamab will be an incredible game changer in the next year. Moreover, we are going to see that CAR-T can be placed also in early treatment, in early relapse, and the CARTITUDE-4 has shown the superiority versus the standard of care. And we have seen also new potential strategies to bridge to CAR-T. I think that talquetamab is really interesting in this sense, but let's not forget also other agents such as selinexor and melflufen that can be interesting in this situation. About CAR-T data, we have seen also real-world evidences with the cilta-cel winning on ide-cel in this analysis, and I think that other interesting results is also from bispecific antibodies. We have seen an interesting study, phase 1b, magnetism 20, in which elranatamab has been combined with carfilzomib. So I think that also this combination is particularly interesting and promising for next stages development. And also we have seen some studies in which bispecific antibodies have been compared in academic center versus community centers, and we have seen that these are perfectly feasible everywhere, and also an elderly patient can offer the same outcome. So absolutely no stopping with using bispecific antibodies everywhere and for every patient in which we want to treat. Other interesting things are the data in academic CAR-T. We are going to see the first results. These are particularly cost effective, and I think that many institutions, also mine, that have approved cell factory will work on that, and I think that we will see also in next conferences new data data of new molecules in academic CAR-T. We are going to see also data with the new target CAR-T, and I think that data in extramedullary disease seems to be really interesting. I think that other really important novelties are about the maintenance. I think that we are going to optimize the maintenance, and maybe the combination bispecific and monoclonal antibody plus lenalidomide will be the best for the future, but I'm particularly curious to see also updates about data in terms of treatment suspension according to MRD negativity data, because the patients don't want to be treated until progression. In the ones in which we reach a really deep response, we should absolutely withdraw the treatment and watch and wait in a strict way. I think this is the future, because we have seen also from some analysis from patient-reported outcomes, the patients that are achieving an outstanding response want to be without treatment, want to live their lives. And I think that in this sense we have seen a revolution in the revolution in myeloma, and I think that the care is not so far anymore, according to the data that we have seen, according to the new targets, and according to personalized treatment that we are going to develop. Thank you for this space.